And I was in Southeast St. Catherine over the weekend. And we know what happened there a year ago. And I had to choose Dr. Dawes because I need a strong Minister of Health. Because you hear the issues going on in the health system. How the people are suffering because of the mismanagement of this Labour Party government. The terrible delay and overrun, the mother of all overruns at Cornwall Regional Hospital. And in all the public health facilities, the way our people are treated when they need care and they need a bed and they need to be admitted, and the long, undignified conditions in which they have to wait for protracted periods until they finally get a bed. It can't work, comrades. So we need that. I told the comrades over the weekend my reasoning why I chose Dr. Dawes for Southeast. And the comrades had a good meeting, they vented, they said what they had to say, I listened keenly. And by the end of the meeting, comrades, Dr. Dawes gave a lovely speech, an authentic speech, and expressed his love for them and his desire for us to work together. And we sang Jamaica Rise in a spirit of unity. So don't watch what the media carried afterwards. I was there. And we had another meeting this afternoon of the entire constituency, because on Friday that was just one division. And we had the whole constituency workers meeting today, and everything was nice and airy.
We'll continue to state with all the rebuttals that may come in from the Ministry of Health. This is not about salaries. This is about infection control, where we are supposed to be using a special type of antiseptic to clean our hands to make sure that the bacteria are all dead before we go and open somebody's body. Solution on the left of the screen is an iodine solution that has an effective kill rate for bacteria. On the right, we are given antibacterial soap that is cut in half to last twice as long. This is about having infrastructure in a hospital where when it rains, you don't have to put a bucket to collect the water. It's about providing us with proper materials. I can tell you that I lost a pair of underpants a couple of weeks ago when I was operating on a trauma victim and blood soaked through the cloth gown, which is of substandard quality. And because I didn't have on a garbage bag, which we were forced to wear at times because there's a lack of aprons, I put myself at risk not knowing the status of the patient when it comes to infectious diseases. The doctors who have been vilified are the same ones propping up the system. When we do not have a tube to drain blood from your chest, we take a tube that is used for breathing, cut holes in it, and that is what we insert in the patient's chest to function as a thoracostomy tube. And I'm afraid Dr. Harvey has been caught with his pants on fire. And we will not sit with him on any other task force or in any meeting to discuss the way forward in terms of healthcare reform. The Office of the Permanent Secretary of the Ministry of Health demands a certain level of integrity. And we have started to ask certain questions. He has misled us. He has made a deliberate attempt to mislead the Jamaican people. We want to know, how long has this been going on? What other issues have we been misled on? Has the minister been misled? Have we been vilifying the wrong man for the Ministry of Health's response to Ebola and chickpea and now this present crisis? How much has he relied on the information for Dr. Harvey to make his statements and move forward in his position? We don't know. And maybe the JMDA should offer an apology to the minister for jumping to conclusions with this new information coming to light. But without knowing the level of reliance on the information and how genuine this information was, we leave it to the minister to conduct his own internal investigations. And if indeed he has been misled, then he should do the right thing and relieve Dr. Harvey of his post as Permanent Secretary of the Ministry of Health.